Hello and welcome to the Health Show. My name is Sal DiBella and I'm your host. Today we have another interesting doctor with us. His name is Dr. James Belanger. Dr. Belanger and his wife, Dr. Karen, are founders of the Lexington Natural Health in Lexington, Massachusetts. So welcome, Dr. Belanger.
Thank you. Thanks for having me, Sam.
You're quite welcome. Now, the first thing I want to ask you is, most people might not know the difference between a naturopathic doctor and an MD.
Okay.
So can you explain to our viewers what that difference is?
Sure, yeah. So naturopathic doctors or naturopathic doctors, they still have to have a bachelor's degree just like an MD does in order to get into a naturopathic medical school. And you still have to have pre-medical requirements. You have to take, biology and chemistry, organic chemistry, physics, get the bachelor's, and then the naturopathic program begins. It's still a 4-year program, just like MD medical program is. Same types of classes, all the conventional classes from anatomy to gynecology to oncology and everything. And you're still learning about pharmacology, you're still learning about the drugs. But the main difference is that the naturopathic medical schools integrate classes on herbal medicine, homeopathy, nutrition, both the use of nutritional supplements and various dietary therapies, and even what's called naturopathic manipulation, kind of similar to what a chiropractor or an osteopathic doctor would do. So you're learning about medications to understand their use so you can work with medical doctors, but we're basically the experts in all these holistic or alternative medicines, the herbal medicines, the homeopathy, the nutrition. And then after you graduate, it wasn't required when I went to school, but residency programs, and then you basically private practices, some hospitals. We're licensed in, I've lost the count, but maybe 14, 15 states. It's not widely accepted yet, but every year it seems to be more and more licensing going on, where basically the naturopathic doctor can serve as a primary care doctor, because we're trained like that. But our main focus is not to prescribe the drugs, but to give you some more natural alternatives to help you with whatever you may have, from cancer to a common cold.
Right. So at your clinic, you concentrate more on people with cancer, is that right?
I do, yeah. But there are naturopathic doctors that focus on gynecology, like my wife, or children, pediatrics. Everybody has their own little specialty. And they might have even done extra training in that particular field.
Mm-hmm. And you have also extra training in laboratory.
Yes, yeah. That was my undergraduate degree, was in laboratory medicine. I felt like it was a really good degree to get all the pre-med requirements, because it was more clinically oriented than, say, studying English or something. So I did a laboratory medicine undergrad degree, and then went to the naturopathic medical program after that.
Right. Okay, so now at the age of 20, I heard that you had cancer.
Yep.
Can you share with our viewers, at the age of 20, what went through your mind at that time? Cancer, God, 20 years old.
I know.
And what you did to cure your cancer?
Mm-hmm. It was interesting. I already knew I wanted to become a doctor. I thought I was going to become a medical doctor. I was halfway through the undergraduate program, actually studying biology, doing all the pre-med requirements at the time. I was even did some what's called shadowing with some oncologists, because I actually wanted to work with people with cancer. And working with this oncologist, he actually encouraged me not to go into that field, conventional medical oncologist. Well then, yeah, on the morning of my birthday in 1990, I woke up with a lump in my testicle. I didn't think much of it. I went to see the doctor. He thought I had an infection, gave me an antibiotic, and it never went away. And so I went and saw a specialist, and yeah, it came back testicular cancer, mm-hmm. which is really common in young men. But I really didn't know much about it. I didn't hear about it. You don't hear about screening for that and guys should check their testicles once in a while to make sure there's no lumps. Like, you know, there is all this advice for women to prevent breast cancer. So yeah, I caught it early, thank God, you know, because my mom had encouraged me to go see the specialist, and the doctor was just taking an antibiotic and, you know, hopefully it would go away. It didn't make much of a deal with it. But right away, yeah, the specialist said, it's probably cancer. I had surgery to remove that testicle, and then just to make sure it didn't spread, I had more surgeries. They removed a bunch of lymph nodes in my abdomen. They removed a piece of my rib because they thought it was in my chest. They went behind my sternum, and everything was clear except for the testicle came back cancer. So that was it. It was just surgery. They said I didn't need chemo at the time. If it came back, I would need chemotherapy. And then I'm like, well, I don't want it to come back because, you know, chemo for a young guy could increase risk of leukemia and then infertility. I wanted to have kids. So I wanted to do everything I could to prevent that reoccurrence. So people start telling me, well, why don't you go see this person or that person or do this or that. So I went and I saw a Chinese medical doctor in Boston here, and he's still there. And I took a bunch of Chinese herbs based on what he prescribed, looking at my tongue and checking my pulse, the traditional way that Chinese medicine approaches it. And I thought it was really interesting. I was brand new to that. I was interested in diet and everything, but the Chinese herbs, that was really interesting to me. And I wanted to learn about that. How did he look at my pulse and tongue and figure this out? And so I took them for a while, and then I started finding out about more types of, you know, other herbal medicines and something called homeopathy, and wanting to learn about diet. And then eventually I did find a naturopathic doctor, and was introduced to him, and he was seeing a lot of cancer patients. But the thing about the Chinese that bothered me was that I was taking these herbs, and I didn't know if they were doing anything. I had early stage cancer. Did I really need to take these herbs? Were they really helping me in some way? After a while, I just, you know, because they tasted awful, I lost faith in them and I stopped. But I had been doing other things, you know, exercising more, changing my diet, had a new look on life. Maybe that all helped too, but it never came back. It's been 25 years, never come back. But after going through that, it made me realize you can do some tests using the laboratory, because that was I shifted my undergrad to that, to really get a sense of what is going wrong with the person's immune system. Why did my immune system not see this cancer at the beginning? And were these Chinese herbs really changing my immune system in some way to make them better at fighting cancer cells? And so that's why nowadays I do a series of lab tests that we can talk about to evaluate a person's immune system. And then I prescribe various herbal medicines and nutritional supplements to correct the imbalances I see. And then I retest. And this way, it motivates the person to continue with the program when you can see changes happening in the immune system for the better.
Right. Okay, so now you have an office in Lexington, Massachusetts.
Yep.
Now, what can a cancer patient expect when they come to your office as far as testing? And all that?
So anybody first visit, but after doing a physical and doing a full history, I always order, 2 to 3 sets of different types of lab tests. Because like I said, the first thing I want to do is, one, evaluate their immune system. We know that, okay, something went wrong with the immune system. This cancer formed in their body. The immune system did not detect and destroy it, and it grew into some, you know, mass. And this is important no matter what stage, early stage like me, after surgery, after they completed chemo, before chemo, whenever. None of the current conventional therapies, well, most of them, I should say, don't work with the immune system. Now, just recently, there's been some approvals of certain drugs for melanoma and lung cancer, of drugs that might help boost the immune system. But most of the, you know, chemotherapy and other drugs, targeted drugs and radiation, don't help the immune system. So that's where the natural medicines can play a big role, because they can help the immune system. But there's so many parts of the immune system. There's what's called T cells, there's killer cells, there's dendritic cells. What went wrong in their system? So I order lab tests. There's a lab called LabCorp or Quest Diagnostics, but usually LabCorp. And I send them to a lab, and I have a series of tests done that are going to evaluate their immune system. I can get into more details. And then I also use this other lab called Pharmacin Labs that also does some other special immune tests that LabCorp doesn't do. So I always do that. Then they come back, like after when the labs are back. And then we discuss what this means and what can be done about it, from dietary changes to basically mental, emotional factors to nutritional supplements. And then what's the beauty of it is you can retest. And this is what I wish I had. We can retest. Did these things in the labs improve? And the research says that when they improve, then if they have early stage cancer, that's going to be one strike against getting a reoccurrence. Or if they have more advanced cancer, that should help slow it down, maybe even stop it, you know, reverse it, start reversing it. So I highly use the laboratories to guide me. I'm not, you know, psychic or anything like that. I don't, you know, I'm trained in Chinese medicine to look at pulses and tongues. I'm trained in laboratory medicine, and that's how I integrate the lab with the natural part.
You know, years ago, I became a hypnotherapist, about 28 years ago. And what I found working with people with cancer for 28 years is that most people that I interviewed that had cancer, they had a traumatic event happen to them. Maybe anywhere from 2 to maybe 6, 7 years. I try to maybe have them deal with that. It could have been a divorce, could have been death of a spouse. And I went and I took a course with Dr. Carl Simonson. He wrote a book called Getting Well Again. And he mentions also that a traumatic event, you know, most of the time, and he had a chart of different things, death of a child, or loss of a job even. And if you have one of these two things mixed together, it could upset your immune system, where you can develop cancer or heart disease or something else. So I was wondering, do you see that in your practice?
Yes, I do. Not all the time, but yes, absolutely. And you know, from a scientific point of view, what's maybe happening in the body, there's a stress hormone called cortisol, which can increase when you have a lot of chronic stress. And it sounds like, you know, cortisone, prednisone, it's an immune suppressive if it is at high levels all the time from being chronically stressed. Like me, I don't know what brought my cancer on, but you know, I'm in undergrad and putting a lot of pressure on myself. Maybe that was one thing, and you know, might have had a high cortisol for a period of time. And cortisol can suppress like our natural cancer fighting cells, the natural killer cells. And then, you know, if a cancer cell is present in the body from you know, having a genetic predisposition to, you know, smoking or some toxin that you've been exposed to, then that cancer cell might not be eliminated because the killer cells aren't functioning well, or the T cells. And then one cell becomes 2, 2 become 4, and there you have a tumor. And then after that, the cancer, once it's pretty developed, it can do its own things to try to stop the immune system from attacking it. And that's where the natural things can help correct that, to rebalance it. And certainly working, I refer to hypnotherapists, you know, acupuncture, biofeedback, all that is all together. It's not one simple pill when you see a naturopathic doctor. It's a lot of changes, from working with mental, emotional factors to taking certain supplements to changing diet, exercise. All that is important.
If we can get into that a little bit more. Now, someone comes in, you do all these testing. After the test, what do you suggest to these people?
So definitely, I find various natural medicines are the first one to start. So it's hard to say because there's so many different variables. See, everybody's treated like an individual. It's not just there's an immune system and everybody gets the same stuff. There's a lot of components to the immune system and a lot of things that can go wrong with the immune system and can change too if the cancer's pretty well developed. But generally I use various supplements, like certain mushroom supplements, not your white button mushroom, but like Coriolis mushroom and Maitake mushroom and Agaricus mushroom. And I use studies that have been published. For example, I mentioned these natural killer cells. Well, There's a bunch of research done on mushrooms such as like something from shiitake or Coriolis. So I would use something like it's already been studied to fit with what I'm seeing in the lab test, and then I retest. So various supplements like that, and other herbal medicines like astragalus root and green tea and curcumin and turmeric, all that kind of stuff. And then I focus a lot on diet too. We probably heard, a lot of people have heard that sugar can feed cancer. Right. Some doctors don't agree with that, but I certainly believe that because of PET scans or radioactive glucose that they give people, and there's more receptor sites for glucose on cancer, so it does uptake it. So I encourage people to stay away from, of course, the white flour, anything that's going to get converted into sugar quickly in the body from white potatoes and fruit juices and all that. And then the second part is a lot of omega-3 containing foods. It's really interesting that there's something that cancer can produce. It's called PGE2, prostaglandin E2, and it's a breakdown product of a type of fat called omega-6 fat. And it's inhibited by omega-3 fats and other things like turmeric or curcumin. And a lot of people now are getting way too much omega-6 fat in their diet because of grain being fed to animals. And corn, for example, has a lot of omega-6 fats in it. The animal eats it, then we eat the animal or the dairy products, and we get all this omega-6. And we're not getting omega-3s like our forefathers used to get. Grass-fed animal products have omega-3s. And certainly, even green leafy vegetables like kale have omega-3s. So I focus a lot on that. And then I certainly refer them often to maybe a hypnotherapist, whatever it kind of seems that they have a liking to, from biofeedback to maybe acupuncture. We talk about that, and then that's usually a lot of time spent there, and then they come back in a month or so later after they've been doing the program, and we see if we're starting to see some good changes with their immune system, and if everything is better, but maybe one or two things that still need a little tweaking, then I'll change something, and we'll keep working on it until I see the whole immune system working well. And I can get in a specific, I have some good analogies that might help people understand the immune system a little bit. But, and then we just go from there. And that usually, when everything's looking good in the lab, it usually corresponds with them doing well. If they're at high risk for reoccurrence, I don't see reoccurrences when the labs are all looking good. If they have metastatic disease, I don't see it starting to grow anymore when it might have been before. And then I keep repeating things because cancer is notorious for becoming resistant to things, whether it's drugs, chemotherapy, or even natural things. And then I change my plan to, stay ahead of the cancer like that.
Right. In the 28 years that I've been helping people with cancer, what I've noticed, and most doctors that I interviewed have the same problem, is that I get people in the 3rd or 4th stage of cancer.
I know.
Unfortunately, where they had the treatment and it's not going well, and they just, unless they did their research and they seen that it's important for the mind-body connection. But most of the doctors that I've interviewed all agree that most of the patients that they get are in the later stages of cancer. So it's harder at that point, maybe, or maybe it's past the point of where you can help them. But can you give us an example of someone that came to you, without names naturally, that came to you and had all the treatment, and the immune system was down, and you helped them, and they're still alive today.
Oh yeah,
after so many years.
Oh yeah, absolutely. I have people come in with stage 4, which is the advanced cancer, where it has spread outside of that organ that it came from to somewhere distantly. And I'm not against conventional. I want to work with medical doctors and other doctors too. So they'll do the conventional, but stage 4 cancers, unfortunately, there's very few that can be cured with the conventional medicine, the chemotherapy. I happen to have testicular cancer, which can respond really well to chemo, But, you know, many other people, colon cancer, pancreatic cancer, lung cancer, breast cancer, when it's stage 4, it's a matter of controlling it, not necessarily curing it for the conventional thing. But I have seen people where it's disappeared and it doesn't seem to be coming back. People that have been coming in for over 5 years, it seems like once it's over 5 years, then it's considered cured. You know, I never like to use that word. It still could be in there, I don't know, but all I'm doing is I'm making sure that they continue a good attitude, they're really enjoying their life, they're eating this nice healthy food, and we keep an eye on looking at their immune system, especially if something happens in their life where they get maybe overly stressed. So I'm constantly looking and keeping their system, creating an unhospitable environment for cancer. But no, I've seen countless times people with advanced cancers have it disappear. But it is certainly harder. It involves more intense dietary changes, more intense nutritious supplement dosing, more laboratory, and it's harder. And some of people, if they're really sick, then it's hard for them to do these things. Both mentally, they're beaten down and everything. So I definitely, I hope people will listen to this and listen. I have a radio show, Cancer Concepts and Complements, to understand the role of the natural medicines as soon as possible, right off the bat. Especially if you have some type of cancer that's notorious for coming back, if it was early stage, or you had some lymph nodes that were positive, or something that might put you at high risk for getting a reoccurrence. That's when this immune therapy that I'm talking about can really shine. When there's not that many cancer cells left still in your body, and then the immune system doesn't have as much to deal with, then waiting for a big tumor to come back, then that's a lot for your immune system to try to deal with, and it can get more intense, the treatment. And like myself, after I was done, they didn't correct my immune system, they just took the tumor out. What was out of balance in my system that led the thing to form in the first place? I would have liked to have investigated that with some laboratory tests, and then I would have liked to have seen some of these, see what those herbs did. Then I probably would have stuck with it more. And that's what I encourage people to do now. At any stage, you do certain tests just to see what went wrong at the beginning there, and if anything that you've read about on the internet and you're taking, is it really correcting these imbalances in your immune system? This is all documented in the research. It's crazy to me that it's not getting to the forefront. But there's numerous studies talking about all kinds of laboratory tests that are useful to run in people with cancer, all kinds of ways the cancer gets around the immune system, and all kinds of natural medicines that can stop a lot of these abnormalities. But it's not all connected. It's not connected. The doctors aren't running these tests. People are taking supplements without doing the tests. So it's kind of like shooting in the dark or something. And I've tried to integrate it more.
But I think you have to do your research if you have cancer.
Absolutely, you got to be proactive.
You have to do your research and see what's out there for you. In my book, 60 Doctors Talk About the Cure and Prevention of Cancer. To give you an example, I have a group. It's called the Messenger Clinic. It's in Cherry Hill, New Jersey. It's run by MDs. Now, I guess why they're allowed to do this is because the patients that they get with lung cancer were told to go home. There was nothing else that could be done for them. So what they do in their clinic in Cherry Hill, New Jersey, is they give people intravenous vitamin C, high dose intravenous vitamin C up to 100 grams. Now, they have had a lot of success with bringing people that were told to go home with their tumors, that there's nothing left to do, and their tumors shrunk and disappeared. Whether it's long-term, I don't know, but this is what everybody's looking for. So I think they're softening up a little bit on when there's nothing else to do, like Dr. Brzezinski. He gets a lot of people where they've had chemotherapy, they've had radiation, nothing left to do for their brain tumor or whatever. So he's doing his clinical trials, and and he's saving people.
Yeah.
Unfortunately, he came up with a percent of people that had chemotherapy and radiation and maybe even surgery.
Mm-hmm.
He came up with a cure rate of 40%, but if they had other issues like diabetes and heart, lung issues or heart issues, it could be even lower than that. But he's getting also all the people that are almost dying.
Yeah.
You know, he's not helping everyone, but he's helping because it might be too late. But he is helping a lot of people, and this is why they did bother him for so many years, so many years. But now I think they realize that he's looking, you know, to just help the people that they can't help.
Yeah, and that's fine too, but I just want more integration where the oncologist is also referring people to a naturopathic doctor or some holistic doctor to do, you know, in conjunction.
Sure, absolutely. Even what I do.
There's all kinds of research. It's all, I do all of my research on Medline. It's called pubmed.gov. And there's a whole host of studies done on natural things that can even make chemo work better if the you know, doctor wants chemo, and certainly helping with all the things that chemo is not addressing, like the immune system. You know, I had testicular cancer. Why is testicular cancer so sensitive to chemotherapy? Or why is leukemias or some lymphomas? You know, they know a lot about why it's more susceptible to chemo and why other cancers like colon and pancreatic and everything aren't. And there's been whole hosts of research done on things that can be done to make the cells, cancer cells, more susceptible, like a testicular cancer, using natural things with the chemo. But for some reason, a lot of oncologists tell people, oh, don't take anything with that chemotherapy, shy away from it, it could interfere. But there's, like I said, a whole host of natural things, including, you know, turmeric or curcumin, that might take a cancer cell that's very resistant to chemo and make it a lot more susceptible. Same thing with radiation, too. So there could be a good integration with that if more research dollars were spent on looking at natural things that the preliminary data says makes chemo or radiation work better, because then maybe then the drugs would work better for these other types of cancers. But then when you're done, too, like most people, like, you know, early stage, they get so many courses of chemo, and then it's like, okay, well, we think we got it all, and keep coming back in for follow-ups. And if it comes back, well, then you've got stage 4 maybe, and you're incurable. That's where the you know, from CME to Brzezinski or any of these, you know, natural doctors to start investigating, you know, looking at the immune system, talk about diet. There is data on this. I mean, not massive studies on it, but you're doing nothing anyway. It's just a watch and wait period. You might as well start doing something active. And I try to incorporate, like I said, laboratory medicine, so you can see some, you know, scientific data that these things are doing something for you. And there are, you know, research studies. If a doctor ever questioned it, like, here's the papers that measuring natural killer cells or something are an important thing to do in cancer patients. And taking this mushroom is correcting that. So.
You know, there is a doctor that is incorporating chemotherapy with what you just said, with everything natural. And his name is Dr. Forsythe. I believe he's in Nevada.
Yes,
and I spoke to him, and he said he's having very much success. And why he's having success, he takes this test called a chemosensitivity test.
I can talk about that, that's a good idea.
And the chemosensitivity test not only tells you what type of chemotherapy might work on you, but it also tells you what supplements
they do
or
one
what
for
you should be doing besides the chemotherapy to get the best result from the chemotherapy. Now, he gives chemotherapy. He don't give as much maybe as another oncologist. He's an oncologist himself. But he said he's had a lot of success doing a little bit of the both. So this is why I don't understand, if it's working in one place, why not explore that?
They really need to.
And see if they can use the both. to help people.
Exactly. Well, you mentioned the chemosensitivity test. I think part of that was getting popular supposedly in the 80s or something, and it turned out that the initial chemosensitivity testing was inaccurate. And so doctors were prescribing chemo based on this test and finding out that it wasn't yielding the results that the test said it would. But they've improved. That was years ago, and they've certainly improved on the methods. But right now, nothing's FDA approved yet. So a lot of doctors tend to give people the same, chemo. So like breast cancer, everybody gets like adriamycin.
But I understand it's covered by insurance.
I'm not sure which one Dr. Forsythe is using, but the one I've used is a lab in Greece called RGCC.
Yes.
I've never seen anybody get insurance coverage for it. Maybe he knows how to figure that out. But I have not seen people get insurance coverage on it yet. But maybe I don't know about that. But they've certainly been doing research on it, but it's not to the point where, the FDA is like, okay, we'll approve of its use. So right now, conventional doctors are just given the standard protocols. So every breast cancer patient, gets adriamycin, Cytoxan, Taxol. But what's interesting that I've seen women have that, and they still have a breast tumor. Maybe they got the chemo first, and maybe the adriamycin, Cytoxan starts to shrink it, and then they move to this Taxol drug, and it doesn't shrink it, and it starts growing, or vice versa. But a lot of times they do surgery first, and then they give chemo, and then you can't see at all what the chemo is doing. If we started instead doing these chemosensitivity tests on everybody, and then prescribe what the lab said would work, that might prevent some of these resistant things from happening, or at least get you started off on a better set of drugs than later. But they need, that right now I think the doctors are waiting for the FDA approval and more research. But what this lab in Greece, RGCC, is doing is really cutting edge. And they are doing it off of natural medicines, like you said. So if patients have already gone the chemo route and they're said, well, there's nothing else they can do, there might be something like natural from vitamin C that you mentioned that does have a lot of activity against that person's cancer. And this lab will incubate the cancer cells with these natural compounds from vitamin C to Laetrile to curcumin and see if it does anything in the lab against the cancer cells.
It's a funny thing. One thing I learned from interviewing a doctor, Cornelia is her name.
Yeah. Oh, yeah.
She gives, and I found out a lot of doctors give intravenous
Yep.
curcumin,
Yes.
which I didn't know before. And they incorporate that
Yes.
into their protocol.
Yeah, curcumin is one of those, it's anybody who doesn't know, it's a natural compound found in the turmeric plant, and it does seem to have better activity the more absorbable it is. So a lot of companies are working on oral forms of it that are maybe more absorbable than just your standard turmeric or purified curcumin. But intravenous might be the way to go.
Right.
Yeah.
Well, and different doctors that I spoke to, like Dr. Brzezinski, it does a number of different things. It does like 20 different things. It helps you with inflammation in your body.
Yeah.
It brings down diabetes, the numbers of diabetes. And it takes away, as Dr. Brzezinski says, the inflammation in the brain.
Yeah.
For Alzheimer's and dementia and things like that. It helps with that. What I just learned not long ago, it even thins the blood. So you don't even have to take an aspirin anymore.
Well, see, there are laboratory tests to see if that turmeric or curcumin is having an effect. And like you mentioned, cancer can often activate the clotting system as a way of trying to grow. We clot to stop, blood flow. But when you cut yourself, you cut a blood vessel. And then a clot forms, and then eventually the blood vessel knits itself back together again. Well, a lot of people probably heard that cancer likes to make its own blood vessels, and it activates the clotting system, just like a wound would, in order to make those blood vessels. And that's where the turmeric seems to come in play. But I have not found, it's actually not curcumin that has an effect on that. It's the whole plant turmeric. Because you see, curcumin is only a component of turmeric. Turmeric has all kinds of other things like turmerones and essential oils and stuff. And I have actually done testing, so I'll measure, it's called fibrinogen, measure that in the blood. And if it's too high, yeah, it puts you at risk for clots. But cancer uses it to help basically grow these blood vessels and spread places. And turmeric, the whole plant, which will still contain curcumin, brings that fibrinogen down. But curcumin purified doesn't. And I've tried different purified forms of curcumin. So, and there's research on turmeric itself, curcuma longa.
There is so much research on
tons of research.
Turmeric.
Yes.
I think that's the #1 supplement that they have researched more than any other supplement.
I think so.
My understanding now, which I just found out not long ago, I knew that it blocked the blood from nourishing the tumor, but I didn't know exactly how. But I just found out that a tumor needs a blood supply to live. Now, say there's, and it's near, say, a blood supply, it gets these like little veins to feed and nourish the tumor. So now what the turmeric does, it goes into the little veins and it stops the it's just like maybe cutting those veins to stop the blood flow and the nourishment to the tumor. And this is why with curcumin turmeric, tumors don't spread as quickly and cells do die.
Yeah, that fibrinogen thing. So fibrinogen is a protein that we all have in our blood. And if it starts rising in the blood, it will then, bind this thing called FGF, which helps induce blood vessel growth. And that's one of the mechanisms of turmeric, or, well, curcumin. And then I mentioned this PGE2 thing, too, this prostaglandin E2, which is a breakdown product of omega-6. That's how curcumin's like an aspirin. It inhibits this enzyme called COX-2 that helps form that thing. So, but you see, there's markers for all this. You mentioned blood vessels. You can measure numerous what's called blood vessel growth factors in the blood. Cancer doesn't just make blood vessels in one way. It can make them in a variety of ways, and you inhibit them from doing it one way, and it will do it 10 other ways. Like if you're going to build a house, and I took all the wood away from you, you're going to use some cement or some bricks or a stone or something else. So you can actually measure a lot of these blood vessel growth factors, and they have all kinds of names like VEGF and FGF and interleukin 8 and this and that. You can measure them in the blood and find out which ones at that time the cancer is using and liking. Because if they're elevated, then it's making a lot of that, or it's causing your body to make more. And then you can start using certain targeted natural things, from curcumin to green tea to resveratrol. And then if a month later you see these things coming down, then in essence, yes, you have stopped those blood vessels from forming. And then you just keep an eye on it, making sure that it's still looking good and nothing changed. You know, cancer does change.
So in other words, each patient that comes in with cancer has a different form of cancer, and you treat them differently.
Everybody, even if it's the same kind of cancer, I might see something different. Treat the person,
and treat to see what they're lacking, whether they're lacking iodine, whether they're lacking vitamin D.
Check those, everybody,
and you check all of that also to see exactly, like years ago, it's amazing, many years ago, I went to an MD, and I was referred to him by a friend of mine that was a thoracic surgeon. And he basically said to me, go see what your body, if it's lacking something. So I went and he took a lot of blood. And he came back with different things that I should be taking that my body doesn't have. Like you talk to some of the doctors, they talk about iodine. Almost everybody is low in iodine, right? Unfortunately, there's so many ways other than supplements that don't taste that great to eat to get the iodine. But that's an important factor for your thyroid, right?
And to inhibit breast cancer, uterine cancer, maybe ovarian cancer, I can talk about how
Yeah, why
that
don't we
works.
talk
Yeah.
about that? Sure.
So iodine, yeah, there's a lot of more research coming out on it right now. But one thing is it actually might help balance estrogen levels in the body. There's actually 3 types of estrogen in both men and women's bodies, and they have numbers, E1, E2, and E3. And what's interesting is that E1 and E2, when they bind to an estrogen receptor on like a breast cancer cell, stimulate them to grow and proliferate. Whereas there's another type of estrogen called E3 that actually can inhibit the breast cancer. And there was this Dr. Henry Lemon who in the 70s and 80s were giving women this E3 estrogen for metastatic breast cancer, finding that it actually shrunk their cancer. And it's an estrogen. So how's that working? It's a weak estrogen in compared to the other 2. And so if you have enough of it, it gets in there and it in essence blocks the other 2 from stimulating the cancer, kind of like this drug tamoxifen does. Well, iodine might help shift the estrogens from E1 and E2 to more of this E3 that helps it block. And it's really interesting, it's found in high amounts in kelp or sea vegetables. And it seems like traditional diets where there's a lot of sea vegetables have lower rates of ovarian cancer, uterine cancer, breast cancer, ones that are estrogen sensitive, and it might be part because of all that iodine. So that's what the preliminary research is showing. And you're right, I mean, who eats sea vegetables nowadays? If you look at the food tables of what's high in iodine, there's not too much that's high in iodine. And maybe that's why all these people are getting thyroid problems nowadays. Before, people started, they were putting iodine in salt, but now people are getting more salt conscious, maybe not using, iodized salt, but then they're not going around and eating sea vegetables either. So it's like a vitamin D, like we're just not getting enough of it nowadays. And we really should, because it might inhibit cancer, among other things. So.
Right. One doctor talks about pink salt. I don't know if you ever heard of that.
Yep.
And sea salt. But he favors the pink salt instead of the sea salt. Now, can we talk a little bit about detox? Do you use that in your practice?
In essence, the diet I prescribe, in essence, is a detox, if you want to think about it that way. I believe that toxins are at a big role in causing cancer, like cigarettes, of course, asbestos, certain charred meats, all this kind of stuff, and that we need to eliminate as much of that as possible so we don't maybe get cancer in the future. But I don't do a lot in doing, in essence, you got to get all these toxic things out of your body to reverse the existing cancer you have. I just haven't seen the data on that. I think it's certainly an important part, but that's not my primary focus. I do put everybody on a diet that's all clean, organic vegetables, nothing, charred meats or any of that. Encourage them, of course, stop smoking and reducing their toxic load, because that might have an adverse effect on the immune system. But I don't, do enemas in people and all kinds of IV treatments for, chelation of, certain toxins and stuff. That's not how I work. I think it's important, especially for prevention. But instead, I use natural things to help.
Natural things, okay, because that works too, to detox.
Yeah, in essence, it's probably detoxing it, but I don't really use that term that often.
You're using it to build up the immune system, and in return, it's getting, clearing the toxins in a person.
Yeah, you could call the cancer a toxin, or you could call some of the things it's doing to avoid the immune system as a toxic substance to the body. Because, or this fibrinogen I just mentioned, the cancer is causing that to be produced in excess. It's something that you shouldn't have in excess. So it's toxic to the body, this fibrinogen, and we are trying to bring it down with turmeric or something like that. So in essence, we are detoxifying that.
What other products are out there that maybe is just as good as turmeric?
Well, that's hard for me to classify, because like I said, I put supplements and nutritional things into categories. So I use turmeric when somebody has a high level of fibrinogen in the blood, or somebody has some high level of something called interleukin-8, and so that there's that. But sometimes people, that it helps, but it's not enough, and then I'll use other things on top of it, like resveratrol or certain enzyme supplements to help bring down fibrinogen. So every supplement has its place, and some need to be paired together in order to really achieve an effect. So I never like, if somebody's cancer is getting worse, my labs will tell me exactly why it's getting worse, and tell me, okay, what worked, what I prescribed, and what didn't. But once everything's working as a whole is when you start seeing results with the cancer. So that's how so it might, just because the cancer got worse didn't mean the turmeric wasn't doing what it was supposed to do. It just wasn't enough.
Right.
And then you need to add other things with it.
Mm-hmm. Okay, so I asked you before, I'm trying to think what the answer was, but in regards to a person that you built up the immune system and you've seen them getting better, what type of cancer did they have?
Oh, I've seen people from lung cancer to bladder cancer to prostate cancer, numerous ones. And I can always tell we're going in the right direction if everything's improving with their labs. It doesn't happen with everybody. Like I said, it takes a certain individual that one is maybe if they have stage 4, they're still healthy enough to make the changes, take the supplements, see the hypnotherapist and all that, and they're very motivated too, versus somebody that comes in very depleted from a lot of treatments and their mind's just not in it. Maybe they were dragged in by their spouse or something like that. So, but the patients that come in that are highly motivated, healthy enough to start the program, have done really well. And I can tell within a few months if things are moving in the right direction. If not, we keep trying, but can't help everybody. But that's why I encourage people to get in as soon as possible.
Right.
Even if they tell you, we got it all,
Right. You have to check. Yeah. You see, you're the only one that'll tell them whether they through your test.
Yes.
This is why not only if they have their mindset on going to get chemotherapy and radiation, they should also go to see someone like you to find out, number one, to build up the immune system. Number two, to see if there's any more activity with the cancer, whether they did get it all or they didn't get it all. And you have most doctors I don't think do it, but doctors like you will do the test to show whether it's coming back, whether it's getting worse, or have answers. And you are a key person, in my opinion, to know. Just because you hear they got it all, that doesn't mean that they got it all.
They won't. It might not create another symptom again until it's already, in your bones or your liver. I mean, it can have to be sometimes pretty advanced to even create a symptom. And sometimes they're not doing CAT scans that often, or there's really even no good, tumor marker for it, like a PSA for prostate cancer. But my labs will tell if there's some change happening in the system that prevents our body from eliminating the cancer. Like do you have an unhospitable environment in your body to form cancer, or you have a hospitable environment? Do you have something in your body that's going to really nurture cancer cells or not? So that's what we're looking at, the environment, or some doctors say the what's the term, I can't think of, it's a really nice term and I can't think of it now, but just, do you have an environment in your body that's going to help cancer grow? Like, is your killer cells really in bad shape? Do you have high levels of fibrinogen in your blood? If you have those types of things, that could, if there was one cell that was missed the chemo or the surgery, that might, all it needs to start growing again. And if you have a lot of stress and everything like that.
Absolutely.
So you can, like I said, see these things, and then I said, well, I'm seeing a lot of fibrinogen. You really should get on some turmeric. I mean, you might have been taking it already, but if it's still high, well, then maybe you need something in addition to the turmeric, like boswellia or resveratrol or something else. And then we change it. And then, like I said, when I see these labs all looking good, I don't see them get anything. And this is important with any stage. And there's evidence on this. It's all throughout. If you go to PubMed and you type in fibrinogen and cancer, you'll find a slew of studies showing that when that's high, it's not good. It doesn't mean you're going to get cancer right away. It's something that cancer likes. So you want to do something to reduce it. And there are natural things that can do that. Or if you have problems with if your killer cell tests show that it's bad, you can fix that.
Right. Now, I mentioned to you before the show that the FDA just changed the protocol for the pharmaceutical companies for pain medication.
Yeah.
In regards to ibuprofen, maybe Aleve, and different over-the-counter medications, that they should put a warning sign that people that are older, they might get either a heart attack or a stroke. So now I've been taking Aleve all my life. You know, I've had back problems many, many years. So now I'm getting older and I'm listening to what they're saying, and you really have to pay attention to something like that, because they wouldn't say it to hurt the pharmaceutical companies if it wasn't true. And I came up with my research. I came up with this Terry's Naturally curcumin. I came up with that, and basically I figured, let me give it a try. It has boswellia in it also, like you mentioned, and a few other things. So, you know, I took this, and you have to take 3 a day, and the pain went away, which is amazing. So I don't know these people. I'm not. I'm promoting them only because it worked on me.
Well, I can tell you why. So those NSAID drugs, you know, ibuprofen and stuff, they're called COX-2 inhibitors. COX-2 is an enzyme in our body that can activate platelet, aggregation, or the clumping of platelets. And it actually takes this omega-6 fat that we eat. You know, if you're eating a bunch of grain-fed meats and grain-fed, dairy products from corn things, you'll have a lot of omega-6 in your diet. And this COX-2 enzyme that's found in our body and platelets and stuff like that gets activated, and then it causes clumping. But when you inhibit that enzyme, right, there's this other thing that's called 5-LOX that does not get affected, and that can also lead to more clotting issues. And that's what's the beauty of this blend, is boswellia affects this thing called 5-LOX, and the curcumin affects the COX too. So you get them both affected. There's this thing, 5-LOX. If that's not addressed, that might be a bad thing. So it gets overactivated with the NSAIDs.
Right. So the only thing that I've seen with this, with me, is you do get a little bloating, and you do get a little gas.
Yeah, that's the trouble.
So what do you think? You think maybe taking it with food, or?
Absolutely. Curcumin and boswellia seem to be better tolerated with food.
With food.
Yeah, boswellia is an herb. It's from frankincense. People don't know that. And yeah, they can be upsetting the stomach, especially if people aren't used to that. If people eat curry or something all the time, they might be very used to it. But taking it with, especially with a little fat, something with healthy fats, or like coconut or something, might be a good thing to coat the stomach.
Okay. Now, we have maybe 5 more minutes, so I just want to throw in, you work with your wife, Karen. Could you tell us quickly what she does?
She focuses on women's health, not necessarily cancer, but women's health, from endometriosis to menopause to PMS to ovarian cysts, that kind of.
Okay.
And I'm the cancer man.
Okay. Now, how do you? I've read somewhere about cysts.
Yes.
To get what do you use, or what does she use? To get rid of cysts.
A lot of it is imbalances in the hormones. So she'll do testing on estrogen and progesterone, but all throughout the cycle. And then there's a class of hormones called androgens, and there's often imbalances in these levels. And so she'll use like plant-like estrogen things, like herbs like dong quai and peony, and like things that don't will if you have maybe say too much estrogen in your system, it will block the excess estrogen, or if you have too little, it will bind and help more stimulate it. She focuses a lot on diet. Carbohydrates, white flours, and all that stuff is really bad for hormone balance.
Okay.
And a lower carbohydrate types of diet with lots of vegetables and omega-3 containing foods.
Now, if someone wanted to contact you, how would they go about doing that?
So yeah, I'm in Lexington, lexingtonnaturalhealth.com, and just looking up my name, Belanger, Belanger is how it's pronounced, Belanger. Pretty easy to find, lexingtonnaturalhealth.com. And there's tons of information on the website, lots on
And your
cancer.
website is what?
lexingtonnaturalhealth.com.
Okay. Okay. And I'm sure you have a lot of good information on the website.
Yeah, there's a lot of good
also.
information. I do have this radio show, Cancer Concepts and Compliments, on the voiceamerica.com network. And you can listen to all the, and it's on the website as well, all these radio shows on cancer.
Is there any parting words you would like to add?
Yeah, just we have a remarkable healing abilities in our bodies. We have a strong immune system that can fight cancer. Let's nurture it with nutritional medicine, mind-body medicine, good diets, and it can do amazing things. Trust that healing power in your body.
Okay. So I want to thank you for being on the Health Show.
Yes, it was wonderful.
And I think we gave people a lot of good information. And you've got the numbers where to contact doctor. So I want to thank you for joining us on the Health Show. And we'll look forward to seeing you again the next time.